Leadership Academy Foundations of Medical Education video series. Watch to learn what advice Dr. Joshua Shupe would give someone considering becoming GME faculty.
My name is Joshua Shupe. I am a outpatient child and adolescent psychiatrist with North Central Healthcare, the county facility here in central Wisconsin. I actually did my general psychiatry residency training at this facility. It's mainly through MCW, Central Wisconsin, but affiliated with Wink now. And I actually did my medical training at the medical school here as well in central Wisconsin with MCW CW.
What was it like to engage with GME early in your career? What do you think are advantages or disadvantages to this timing?
So, in terms of thinking about starting a GME related education supervision right away in my career, it was something that was a bit intimidating to think about. Originally, when I was about to be graduating from my training program and interviewing for jobs, I remember talking to them saying, I want to be involved in the educational process, but I'd like to get my feet on the ground for about a year maybe before I would feel more like comfortable and competent to do some of the supervision and the training. But then I had a good mentor. She's been a good mentor for me since my general training, psychiatry training. And she's actually the program director here. She was really encouraging me to get started right away with it. I think it was kind of a balance of recognizing the need, that the program might have, and so wanting to be a part of helping out. And so that helped me like feel confident enough to take the plunge. And it was a little intimidating at first. And I think ultimately, though, I'm really glad I decided to do it right away because it feels like a nice continuum between my training and then seeing what residents are going through training in now and keeping me connected to that. Again, it's intimidating because initially coming in thinking, well, now I'm the attending, I need to be the one that knows everything. But that's not the case. Again, referencing maybe another mentor, he was really helpful in just helping set my mind of when coming into this next phase of my career, you're not going to know everything. There might be this sense in your mind that because you've reached this milestone of graduation, that now you should have everything tied up nicely, with a bow, but that's just not how it is. And so I think accepting that and being open to the process of not knowing, but being a part of helping the residents has really helped me actually develop my sense of confidence because maybe I came in thinking I don't know a lot, but then seeing how residents are and where they're at, it's making me realize like there is something that I've taken away from my training that I can help, um, teach them. And that's really too, has been a really rewarding thing is just going into the process of feeling like I'm giving back especially to the program that helped train me.
What was your biggest fear when you got started teaching, and how did that compare to the reality of teaching?
I'd say my biggest fear when I started teaching was thinking that I was going to have all the answers and that if I didn't that then I'd be, in that realm of feeling like a failure or like I was letting people down. And I think that was a natural thought process even coming from graduation, right? It felt like I had to know everything to be able to graduate, but that's just not the case. And so I think kind of continuing that thought process when teaching, it's okay if there's something that I'm not sure about. And I think actually expressing that humility with the residents has actually been really helpful to kind of teach them to realize they don't have to have all the answers all the time. And that's not to say we're just bumbling through things, not having a clue of what we're doing, but it's just recognizing that that little bit of fear and intimidation, that voice in our mind that might be saying like what we want to be worrying about isn't as big as you think it might be. And it's okay too, if we don't know something.
What are some of the challenges you faced as a new faculty member, and how did you overcome them?
I think one of the challenges that I was faced was the concern that teaching was going to take away from my time in clinical practice and building kind of that foundation of my beginning years in my career and take away from my opportunities to learn. However, I've actually found that my learning has almost been accelerated in a way because as I'm supervising residents, I'm getting more opportunities to see more patients all at once. And also, it frees up my mind a little bit to not feel as bogged down by all maybe like the clerical or footwork of things, but think about the higher level, concepts that are important. And so, really, it's been an opportunity for me to accelerate my learning in a way.
What motivated you to consider becoming faculty?
What initially motivated me to take on this faculty position was encouragement from a good mentor. She's the program director here, and she was a great mentor during my residency training. And so, with her encouragement and her confidence in my skills and abilities, I feel like that really helped me take the leap of initially starting. And ultimately, too, there is some part of my mind thinking, like, it would be nice to give back. I mean, this is the same program that I did my training in, and so there is that piece of wanting to give back. And honestly, seems to be the thing that keeps me going, is making that connection with these trainees, with the residents who, um, I can empathize with. I feel like I was in their shoes, and it feels very rewarding to help them through some of that intense learning at times with clinical care. And so that's ultimately something that makes it feel quite rewarding and makes me want to keep coming back to it.
What does teaching fulfill that clinical practice alone doesn't?
What teaching fulfills that clinical practice alone doesn't for me is, I feel like anybody who's going into medicine has that sense of altruism, right? That idea that you want to be giving back, you want to be helping others. And that can be fulfilled in clinical work. And there's a lot of fulfillment in thinking about the, knowledge and clinical skills that you've developed and helping a patient. But that also can come with some burden in some sense. I mean, especially in psychiatry, I think it can go without saying, like, sometimes the care itself can be pretty emotionally heavy. And so, having an opportunity to maybe almost take a break from that and work with trainees and residents, it helps kind of reduce that cognitive emotional burden and shift that energy into something else that still feels like you're moving forward with that value of altruism because you're still helping somebody. And I think there's a lot of fulfillment in the idea that you're moving a little farther upstream, right? From this concept of people falling in the river, pulling them out of the river. If you can work upstream a little bit more to understand why are they falling in the river and maybe develop a system that helps prevent people from going down that path. That's what it kind of feels like when working with residents. It feels like you're helping the broader system, the specialty. And so there's a lot of fulfillment that you get outside of clinical care. Clinical care, I'm helping the direct patient, but with training, you feel like you're helping the overall medical culture, again, which can be really gratifying.
What advice would you give someone considering becoming a GME faculty?
If someone was considering working with graduate medical education at all, the advice I would give is just go for it. If the opportunity is there, take advantage of that. And I think it's just being open to the idea that you could try it out, right? It doesn't have to be this full commitment. It's something that you could just have an opportunity to experience and see what you notice. I think you might be surprised too that, again, as I had mentioned, it fulfills something that you might not have anticipated. So I'd say just give it a shot and see what happens.
What advice would you give someone who has thought about becoming a GME faculty but isn't currently connected to a residency program?
So if someone might not be as connected as I was with like the program that I trained in, but they're still interested in being a part of GME, I'd encourage them to at least reach out. What I've noticed within my program in particular and what I've been told with Wink is that everyone is open to having that help. And so if you're interested at all, it would be great if you just took that step to even reach out, because I can let you know that you're needed. People want to see some improvement in the educational system. They want minds like yours. So just reach out and see what happens.
Leadership Academy Foundations of Medical Education video series.